We are seeing continued high rates of infection with the coronavirus here in Philadelphia, but there is some better news about the epidemic. And of course, there's some very exciting news about the vaccine. First, though, the numbers. Since this time yesterday, we've identified 1,223 new cases of the coronavirus infection in Philadelphia residents confirmed by the PCR test, bringing us to a total of 81,708 since the beginning of the epidemic. And in addition, 111 new probable cases diagnosed by the rapid antigen test. Now, in part, those are very high numbers, but in part they're high because we received a very large number of test results today, more than 13,000 results. But overall, there's just plenty of cases that are occurring in the city. For the past week, December 6th to December 12th, we averaged 784 cases per day so far, but we expect more with delayed reporting. And 10.8% of the people tested positive. To put that in comparison, the previous week, November 29th through December 5th, we averaged 1,028 cases per day. That's the first time we've averaged more than 1,000 cases per day for an entire week. And 13.0% of the tests were positive. So as you can see, there's extremely high case counts, but there is signs that the spike that was caused by Thanksgiving may be subsiding. Now, for Pennsylvania as a whole, there were more than 7,500 cases reported yesterday. And the Commonwealth is averaging now more than 10,000 cases per day for the past week. If you look at that comparison, you can see that there's evidence that the safer at home restrictions we put in place in Philadelphia on November 20th have helped reduce the spread and limit the size of the Thanksgiving spike. Between November 20th and December 12th, when the Philadelphia restrictions were in place, but the state did not have restrictions in place, according to the state's data, Philadelphia's case counts rose 7%. During the same time period, the state's case rates rose much more. They rose by 66%. So evidence that we've limited that increase with our restrictions. So we know those restrictions are very difficult for some businesses here in Philadelphia, but they clearly are important. What about our hospitals? In Philadelphia this morning, there were 920 patients with COVID hospitalized. That's an increase of about 30 since a week ago. Now that's an increase that's relatively small after it was rising very quickly for the month before. So still a large number of patients, but it's a good sign that that number appears to be stabilizing. We hope to keep it below 1,000. What about deaths? Since yesterday, we've identified 6 new deaths from the coronavirus infection in Philadelphia residents, bringing us to a total of 2,141 since the beginning of the epidemic. Now, our data on deaths tends to come in batches, and it's often delayed by days or even weeks. And overall, we're seeing a rising trend in this. For the week of November 22nd, we had 67 deaths. For the week of November 29th, there are 41 deaths so far, but we certainly expect more. And we may approach 100 deaths per week before the end of the year. Now, on to vaccination. This is clearly a historic moment in the biggest pandemic in history. The Pfizer vaccine was approved last week, as you know, and has been shipped to the city of Philadelphia. It's arriving yesterday and today and tomorrow. And vaccination is planned to start in most hospitals across the city tomorrow. Let me give you a little bit of the background on the study on which the FDA approved the vaccine. The study was done in 43,000 participants in the United States and 5 other countries. Half of those people received the vaccine and half received a placebo. That's a fake vaccine that has no effect. The researchers then tracked nearly 19,000 people who received the vaccine and an equal number that didn't receive the vaccine over more than 2 months for follow-up. And they found that the vaccine was highly effective. Overall, 95% effective. To put it in raw numbers, amongst people who received the placebo, 162 contracted COVID. But amongst people who received the vaccine, only 8 contracted COVID. The vaccine was not only effective overall, it was effective for older people, it was effective for people with chronic medical conditions, it was effective equally for people in different race and ethnic groups. They also found that the vaccine was safe. There were no serious adverse effects felt to be related to the vaccine. On the other hand, side effects were common. After the second dose, about a third of the people who received the vaccine had chills and muscle aches, and about 15% had fever. That's a sign that the immune system is working. It's doing what it's supposed to do. Overall, with this study, these are absolutely excellent results. Based on those results, the vaccine was approved last Friday by a committee of more than 20 independent experts convened by the FDA. It was then approved by a second committee of experts convened by the CDC. And then it was approved by a third committee of experts that were independent, convened by the states of California, Nevada, Oregon, and Washington. All those groups recommended the vaccine overall, and they recommended it specifically for everyone over the age of 16, unless they've had a serious allergic reaction to previous injections. So that's all excellent, excellent news. But the Pfizer vaccine is just the first vaccine. It gets better. A study on a vaccine produced by the Moderna company was posted just this morning. This is a study on 30,000 volunteers, of whom they've evaluated 14,000 who received the vaccine so far, and 14,000 who received a placebo. And of those, 90 who received the placebo contracted COVID, but only 5 that received the vaccine contracted COVID. Amongst people who got severe disease, there were 30 in the placebo group and 0 in the vaccine group. Overall, the effectiveness was 95%, just the same as the Pfizer vaccine. And just like the Pfizer vaccine, was just as effective in different subgroups of the population. So more excellent results. That means likely we will have 2 vaccines to offer here in Philadelphia next week. And we're maybe be able to offer more vaccines in the first quarter of 2021 because there are other vaccines that are in phase 3 trials right now. Which brings us to who's going to get the vaccine here in Philadelphia. Well, the population has been broken down into different groups, and those groups have been ranked in priority based on 3 factors. First, the likelihood that somebody will acquire the infection. Some people are just more exposed by the nature of the work that they do. Second, the risk that someone who gets an infection might have a serious infection. So, for example, people who are much older are much more likely to have a serious infection than people who are younger. The third factor is the risk of spreading the infection to others who themselves can get a serious illness. So, for example, a nursing home worker would score very high on this because it might be able to spread the infection to nursing home residents who are very vulnerable. With those 3 factors in mind, the general priority groups ranking looks like this. First, there are healthcare workers exposed to COVID, such as people who work in hospital emergency departments, from doctors to the clerical staff, and residents and staff at nursing homes. Then would come critical infrastructure workers. That's a large group of people who do essential work in person, and as part of their work, they're exposed routinely on the job to COVID. Then there'll be people who live in congregate settings, where they live together other than nursing homes, such as people who live in group homes or behavioral health facilities. Then there'll be people over the age of 65, because we know that older people are much more vulnerable. Then people with underlying medical conditions, and then everyone else. So we're going to start vaccinating with those first 2 groups, and then we will refine that list that I just gave you in the future based on more detailed recommendations we hope to get from a CDC committee and from our local vaccine advisory committee. How long will it take for this vaccine to roll out? I get that question a lot. Well, a lot of that is unknown because we don't know how quickly the manufacturers can produce this vaccine. I can say it's going to roll out over months, but I can't say how many months it will be. How will we distribute it in Philadelphia? Well, in the beginning, we're going to be distributing it mainly through work sites. So hospitals will be vaccinating their own staff, nursing homes, people who work in nursing homes, people who live at nursing homes will be vaccinated there, and employers will be getting vaccine to vaccinate their own employees. But we'll expand many other types of sites as the priority groups expand and more people are eligible for the vaccine. Now, I've gotten a lot of questions about public education because some people are hesitant to get the vaccine. It's a new vaccine, and you can completely understand why that's the case. So right now, when the vaccine is in short supply, it doesn't make sense for us to have a public education campaign to tell people to get the vaccine. But later, when the vaccine is more widely available, or vaccines more widely available, we will be doing a campaign to encourage people to be vaccinated. Overall, this is really a stunning achievement that scientists developed 2 vaccines so quickly and that they've proven to be safe and effective. And I clearly see this as a turning point in this epidemic. In general, I consider vaccines to be the greatest discovery in medicine. And I'm very hopeful that this and other vaccines will ultimately end this pandemic, just as vaccines have ended epidemics of smallpox and polio and measles. But it's going to take months for us to vaccinate enough people in order to get back to normal. In the meantime, everyone's risk of contracting coronavirus is still extremely high here in Philadelphia. We still need to use every other tool to protect ourselves in the meantime. Which brings us back to our restrictions. The safer-at-home restrictions are still in effect, and the governor's restrictions are still in effect. That means no indoor gatherings. Don't have people over to your house. Don't gather with people. No indoor dining, no indoor sports, gyms, no museums, no libraries. If you do want to get together with people outside of your household, do it outside and have everyone wear masks. We're asking everyone to follow those recommendations closely. Now we have more holidays that are occurring now, such as Hanukkah, and more coming up, including Christmas and New Year's. For Thanksgiving, most people followed our recommendations, but too many didn't. We did have a big spike in infections. We can't afford to have another spike like that Thanksgiving spike. So what should everyone do? Well, work from home unless it's impossible. When you're around anyone who's not a household member, wear a mask and celebrate the holidays with your immediate household members only, the people you live with every day. Don't invite your relatives and friends who don't live with you over the holidays, and don't go to their place for the holidays. It doesn't matter if they've been tested or if you've been tested. Don't get together over the holidays. We know that's very difficult during this holiday season, but you don't want to pass COVID on to your grandmother. Don't make the mistake when we're so close to the finish line. More information on all this is on our website, www.phila.gov/COVID. Thanks.
Thank you. Good afternoon, everybody. I have a couple of questions for Dr. Farley. Dr. Farley, you talked about some of the possible side effects and reactions to the vaccinations. I wonder, with hospital staff already under stress, maybe stretched thin, is there a concern that if doctors or nurses have a reaction to the vaccine that they'll have to take a day off? And I just wonder how you manage that.
Yeah, they're all aware of that. And so most of them are planning to not have everybody in the unit be vaccinated on the same day, because then they might all be feeling lousy on the same day and they might have difficulty staffing that unit. They'll be staggering the schedule of the different units so they are not all sick on the same time.
Makes sense. How long do you think it'll take to vaccinate the first group?
The first group is kind of hard to define. I can tell you that we think we can distribute the vaccine as quickly as the manufacturers can produce it and ship it to us. So it won't take long for this first batch of vaccines to be given to people all over the city. But there are, many tens of thousands of healthcare workers in the city, and many more than we have vaccines for right now.
Do you, I guess, can you talk a little bit about how getting the vaccine to medical workers ultimately helps get the next round of vaccinations going? For example, the Black Doctors COVID Consortium, my understanding is they'll be part of the first round of vaccinations. Are they likely to help vaccinate police, firefighters, maybe teachers, SEPTA workers?
They may be asked to do that. We have talked to them about them potentially offering vaccinations. But many of those large employers have their own employee health services, and they have people who can vaccinate. For example, firefighters includes people who are EMS workers, and all the paramedics, they can give out vaccinations. So for the most part, these large employers, we're just going to give them the vaccine and they can find their own staff to do the vaccinating.
But will that ultimately help you vaccinate more people in Philadelphia by having them?
Absolutely. So, we ultimately will need many different organizations and sites to offer vaccine. And so the Black Doctors Consortium may be one of many community groups that are setting up sites for vaccination. Employers will be doing it. Pharmacies will be doing it. Ultimately, doctors' offices will be offering this. It's going to be have to draft many different sorts of organizations to make this available to everyone.
Thank you, sir.
Dr. Farley. Thank you, Mitch. We're going to go now to Johan Calhoun at Chalkbeat. You can unmute yourself and ask your question.
Thank you and good morning. Mayor Kinney, you and Dr. Haidt said that you were pushing for educators to be next in line to get the vaccine behind healthcare workers. Does that look like it's going to happen?
I think that's more. I would like to see educators vaccinated as soon as possible. But maybe Dr. Farley has more insight medically on the feasibility of that.
Yeah. So when I spoke about the second big group, or critical infrastructure workers, that's a very large group of people. But included in that group would be teachers, because they are very likely to be exposed on the job. Now, they're not the highest risk because they're not likely to pass the infection on to vulnerable people, because they're exposing other children who tend not to have a problem with the vaccine. So they're not as high priority as, say, someone working in a nursing home. They are in that critical infrastructure group, and we're getting to them that well above other groups in the city.
And one of the ancillary benefits to doing teachers is that it gives them a level of comfort that they can go back to work sooner, get our kids back into school, and get parents who are home doing home care and education at home back to work. And that'll help the economy move faster forward.
Thank you. Will schools be utilized as locations to be distribution sites for the vaccine?
Doc?
Possibly. We've looked at a number of different sites to set up vaccination, schools amongst them. And I don't know ultimately what we'll need. Again, there's many different sorts of existing providers that we're going to tap into for distributing vaccination. So it's unclear how many new sites we need to set up, but if we do need to set up new sites, schools are a possibility.
Okay, one more question. Do the high COVID numbers and restrictions change anything for the student access centers?
No, the student access centers are still open, and you know, in the same way that elementary and middle schools are still allowed to have in-person education.
Can you guys give numbers on school-aged children? Do you have any update with that particular student population? Well, not specifically student population, but with that age bracket, how are the numbers looking with COVID?
There are numbers on our website, and we can give you more details if you want beyond that. I can tell you that we have very high rates among children, as we have very high rates amongst everybody right now.
Thank you, Johan. We're going to move on to Denise Clay, Philadelphia Sunday Sun. You can go ahead and unmute yourself and then ask your questions.
Yes, thank you. My question is directed to Dr. Farley. You mentioned that the order for the vaccine was going to be workplaces first, and from there it would go to other first responders and stuff. When it comes to people with pre-existing conditions, has there been a plan put in place in terms of getting them the vaccine? Will they go before like normal healthy people without symptoms? And I guess, how does that work?
Yeah, so I gave you the general list of priority rankings, and I said people with underlying medical conditions, that was on the list. So that would be above people who are healthy, don't have an underlying medical condition. Okay. The number of people with underlying medical conditions is very, very large in Philadelphia, hundreds of thousands of people. More of them than there are people who are, you know, when you count everybody, than the people who don't have any risk factors. But they are in that group, and they would be above people who are healthy.
Okay, is there any idea of when they will start getting the vaccine, or will that just depend on the number of doses that the city gets?
It depends on the number of doses. We really can't project out how quickly we're going to go through those different priority groups.
Okay. And will there be, like, I guess, a hierarchy in terms of people with pre-existing conditions? Like if, say, you're an insulin-dependent diabetic who has had an amputation, would you go before the person who's just a plain old insulin-dependent diabetic?
Yeah, so I said that we would take that list that I just gave earlier, the different priority groups, and we'll refine that list further, depending on recommendations from a federal advisory group. It's called the Advisory Committee on Immunization Practices. I'm told that they may come up with their own further breakdowns within that list. And if not them, then our local vaccine advisory committee may make further breakdowns of rankings within those groups because they're very large.
Okay, thank you.
Thank you, Denise. Next up, we have Jack Tomzik at the Philadelphia Metro. Jack, you can go ahead and unmute yourself.
Yes, thank you. This is for Dr. Farley. How many doses do you expect to receive of the vaccine this week and next week?
There's a lot of information we don't have that we wish we have. I can tell you that we are receiving this week from the Pfizer vaccine 13,650 doses. And that next week, we don't know how many doses we're going to receive of the Pfizer vaccine. I'm told we will receive 27,600 doses of the Moderna vaccine if it is approved. Beyond that, we don't know.
Okay, thank you. And then a follow-up question. Dr. Rachel Levine said yesterday that the federal government is keeping, for every dose that the state gets, is keeping a dose in storage so that each person can get 2 doses. Is that the same happening for the city? And if so, is that included in those doses, the 13,000, for example? Is that counting the doses that are stored by the federal government?
No, those are just the doses that we receive. And my understanding is for every dose we receive, there's another one stored out there for the second dose of the people we vaccinate.
And then kind of following up on Mitch's question, do you have an estimate on how many people are in that phase 1A in terms of healthcare workers, nursing home residents, and nursing home staff?
Well, I can only say that when you look at all healthcare workers combined, and you define healthcare worker very broadly to include, for example, clerical people who work in a hospital, or people, even volunteers who work in a hospital, it's over 100,000 people. Now, not all healthcare workers, though, are routinely exposed to COVID. In some broad sense, I might be considered a healthcare worker, but I'm not routinely exposed to COVID. I would not be in that group. And so we're less certain as to how many people are really routinely exposed to COVID.
Thank you.
Thank you, Jack. Next up, we have Kennedy Rose from the Philadelphia Business Journal. Kennedy, you should be able to unmute yourself and ask your questions.
Thanks so much. My first question is for Mayor Kenny. I was wondering, do you know if the previous $30 million in CARES funding that was allotted to the state, do you know if that funding was exhausted, or is that out of the city's hands at this point?
I don't know. We could certainly get back to you. If anybody else on would know that, please chime in.
Kennedy,
If
we'll
not,
have to check on that one for you. Since the money was directed to the state and they're responsible for getting that out there, we'd have to check in with them to see if they've given us a notification, but we can follow up.
Okay, that sounds great. And my next two questions for Dr. Farley. Dr. Farley, a coalition of restaurant owners have set up a free COVID testing site for restaurant workers and their families out of the GOAT in Rittenhouse Square. And I was wondering if this is a model that you would recommend that other industries follow.
You know, I don't know enough about that site to know whether it's, whether it serves as a model. In general, we want testing to be more available to people.
Okay, and I was wondering, do you know if the city has any plans to provide funding or support for other sort of testing initiatives like this if, say, an industry wanted to go ahead and start its own testing program?
I can say we have a request for proposals that's out there, and it's been out there for months, for organizations who want funding to run testing sites to apply for funding. And we funded about a dozen different organizations. And they have to meet criteria. They can't just say, we're only going to test these people. They have to be open to essentially all comers, and there's many other requirements. But that funding is available to groups who want to make testing more available.
Okay, thanks very much.
Thank you, Kennedy. Next up, we have Carolina Rodriguez Plaza from Univision. Carolina, you should be able to unmute yourself and then ask your questions.
Hello, everyone. Can you hear me?
Yes, you're good, Carolina.
Thank you. I will need Armando, please.
Buenas tardes, Carolina, con gusto.
Gracias, Armando. ¿Qué tal? Tengo dos preguntas, una para el Dr. Farley y otra para Mayor Kenny, por favor.
Adelante.
Para el Dr. Farley, me gustaría de su parte si nos puede dar un mensaje a las personas los hispanos en Filadelfia. Muchos nos han contactado preocupados por la vacuna. Algunos pues temen que no sea segura, que se hizo tan rápido. ¿Cuál sería el mensaje de él como la autoridad médica de la ciudad en este proceso, teniendo en cuenta que ha habido sobre 5.500 hispanos infectados con el coronavirus en Filadelfia? ¿Cuál es su mensaje?
The first question, because I have two, is directed towards Officer Thomas Farley. And this is, what would be your message to Hispanics in the city that are concerned about the vaccine? Some of them are thinking that it may be unsafe or that it has been approved too quickly. And as a medical authority, given that there's been about 5,500 cases of Hispanics infected in Philadelphia, what would be your message to them?
Well, I can certainly understand why anybody would be concerned about the vaccine because it was developed very quickly and it was tested quickly. On the other hand, that study has really shown excellent results. And as I just pointed out, 3 different committees of independent experts looked at this and felt strongly that the vaccine was safe and effective, and therefore they could strongly recommend it. And based on that, I also would recommend this for anyone who is at risk for getting the virus right now, if they meet our priority groups, and ultimately for everyone.
Comprendo la preocupación porque esta vacuna se desarrolló rápidamente y se hizo prueba con ella rápidamente, pero los estudios que tenemos realmente nos han demostrado excelentes resultados. Quiero indicar que hay 3 diferentes comités independientes que han visto a esto y sintieron ellos de que la vacuna era eficaz y segura, y por lo tanto han recomendado, diciendo de que es eficaz, les recomendando que la utilicen las personas que están en riesgo de contraer la infección. Entonces, tenemos que ofrecerla a todas las personas, empezando con los grupos de alta prioridad primero.
Gracias, Armando. Y la segunda pregunta sería dirigida al alcalde Kenny y es en referencia al seguimiento sobre los fondos para las personas sin hogar que estaban previstos para ser desalojados esta semana. Ellos estaban hospedándose en un hotel en la ciudad y son vulnerables al contagio de coronavirus. ¿Tienen alguna actualización al respecto?
Bien, gracias. The question is from Mayor Kenny, and this is a follow-up in regards to the funds that had been allocated to help the homeless that had been housed in a hotel in the city that are to be removed from there this week. They are a vulnerable population. Is there any follow-up on these funds for them?
Or they're not being removed from there. They're being placed in secure housing. And I'll let Eva go into more detail.
El alcalde nos dice que no van a ser retirados de este hotel, sino que se les va a dar viviendas seguras, y Eva Gladstein nos va a agregar un poquito más ahora al respecto.
Good afternoon. From the beginning of when we established the COVID prevention sites, we were aware that we would need to be moving out of the hotels by the end of December, given the unfortunate fact that the federal funding ceases to be available after December 30th. We've been working since the beginning to help residents move to longer-term housing options. Dozens of them have done so, and more are scheduled to do so in the next few weeks. However, for those who are not able to connect to those longer-term housing options right away, for whom it'll take a little bit more time, we've set up 2 community-based sites that will also be COVID prevention sites, and folks will be able to stay there until they can access the longer-term housing.
Buenas tardes, nos dice Eva Gladstein. Ante todo, nosotros sabíamos desde el principio, cuando empezamos este programa, que los fondos federales que recibimos iban a acabar para finales de diciembre y tendríamos que transferir a las personas desde los hoteles a lugares seguros. Y hemos estado trabajando para ofrecer docenas de opciones a estos residentes. Tenemos algunos que ya se han dirigido a otros lugares y otros que vamos a sacar. Aquellos que no tienen opciones inmediatas, va a tomar un poquito más de tiempo. Pero tenemos sitios basados en la comunidad que son COVID seguros para el COVID, donde vamos a estar transfiriendo a estas personas.
Thank you, Armand. Thank you, Major and Eva, for the answers. Have a good day.
Thank you, Karen.
You're welcome.
We are going to go next to Sherry Darden at Scoop USA. Before I go to Sherry, I just want to let everybody know we have about 15 minutes left and still about 10 reporters to get through. So we're going to ask everyone to keep this to just 2 questions each at this point so we can get through everyone. And if you follow up, you can always send those to press@phila.gov. So Sherry, go ahead.
Good afternoon, Mayor and Dr. Farley and everyone else.
Hi.
Question is for you, Mayor, or Dr. Farley, whomever can answer. It's with regard to communication and the topic of the vaccine with the people who are, I guess, because of people not really wanting to take it, I guess is the easiest way to say it. Is there any messaging or communication that the city's going to do to help us deal with that population and actually get people to take the vaccine? Because right now, there are a lot of people who are scared.
I think organizations like the Black Doctors Consortium and other groups like that will be helpful in being able to show people that it is trustworthy and that the vaccine is effective, and that especially for people of color who are suffering more from it than people not of color. We're going to utilize those organizations to get that word out, plus what the city's going to do. And I think Dr. Farley had more information.
Okay, thank you.
So yeah, as the mayor said, we will be working with messengers like that and just working with community leaders right now. But also we will be doing a media campaign, a paid media campaign to encourage people to get the vaccine and talk about how safe and effective it is. Right now, though, we have the opposite problem where we have more people who want the vaccine than we have doses to give out. And so that education will occur mostly later.
Okay, thank you. So I'm assuming, and this is probably my last part, the education going later would be probably in the next 3 or 4 weeks once we actually have proof that it's safe, right?
Well, we have proof that it's safe right now. The education is probably going to be more than 3 or 4 weeks from now. It's when we get to the point where there's enough out there that anybody who really needs to get it can get it.
Okay, thank you. Thanks a lot for answering.
Thank you, Sherry. Next up, we have Mike Donafrio from the Philadelphia Tribune. You should be able to unmute yourself, Mike.
All right, sure. So Dr. Farley said that the vaccine will arrive yesterday, today, and tomorrow. But when will the actual first dosage be administered? And do you know where and what hospital or workplace will actually do it?
So there are multiple hospitals that have the vaccine and will be offering it tomorrow. I can't tell you whether they're going to be doing it at what time exactly and which one's going to be first, but they probably several that will be vaccinating tomorrow.
All right. And since the health department obviously is managing, I believe, the distribution of the vaccine, how, I guess, is it going to ensure it is given out equitably, especially to people of color during this initial phase?
It's this very first batch is going to a small number of hospitals, and then it'll be redistributed then to every hospital in the city. And those hospitals in the city will then vaccinate it to people who meet the criteria that have been established by the federal advisory group and our advisory group. All those advisory groups are fully aware of the fact that the virus has more severe infections amongst people of color. In addition to the hospital initiative, there are going to be vaccinations going out in nursing homes for the staff and the residents next week. The employees there are the people in hospitals and nursing homes are going to be essentially the first group. Those employees tend to be more likely African-American. And so it's going to be appropriate targeting based on their occupation. And likewise, as the groups have been prioritized, you're going to find that the racial groups that are more heavily hit are going to be more likely to get the vaccine by the nature of their occupation.
Thank you.
Thank you, Mike. Next up, we have Kelly Rule at Fox 29. Kelly, can go ahead and ask your questions.
This message is for Dr. Farley. Out of those 13,600 doses roughly that you are coming into the city this week, are you able to say how many are specifically going to hospitals and how many are going to nursing homes?
That batch is going to almost all be going to hospitals. The nursing homes in general will be getting the batches next week.
Next week, okay. And I can hold this for later, but I'm thinking, you might have the answer to this now. Are there concerns that the storm this week will cause any kind of issues or delays in receiving the vaccines or even administering them?
I don't think so, although I can't predict because the vaccine should have arrived either yesterday, today, or tomorrow. I guess I don't know when the storm is hitting. I guess the tomorrow shipment could be a problem. I do know there's a lot of thought been given to the logistics around this, and so I'm hopeful that we won't see a problem with that.
Thank you.
Thank you, Kelly. And next up, we have Martin Pratt at Philly Your Black News. Martin, you can go ahead and unmute.
Yes, two questions. Dr. Farley, have you or the City Department of Health outlined how you'll deal with someone that may not know they have an allergy and they take the vaccine and they have this bad allergic reaction? Because we know that the CDC has advised people with allergies not to take the vaccine right at this current state. But there's a lot of people that may not know they have an allergy and they get the vaccine and they have a reaction.
And so the bad reactions that were seen, first of all, there were no bad reactions seen in the trial when they vaccinated tens of thousands of people. It only occurred in England, and there were two people. These were two people who had previously had a very severe allergic reaction, an anaphylactic reaction. That's really very rare. This is not like people who have a typical, hay fever type allergies or food allergies. This is a very rare condition. And generally speaking, these people know about it. They often carry around what's called an EpiPen. That was the situation for those people there. So the recommendation is those people shouldn't be taking the vaccine. But other people, we think it's going to be extremely rare. Whenever the vaccines are given, though, people have medicines and equipment on hand so they can deal with any adverse reaction, any allergic reaction that comes up as a surprise.
And the second question is regarding us as media. We know that the media was categorized as essential workers. Is the health department, the mayor's office discussed when we're going to have, after vaccination happens, when we'll have in-person press conferences?
I have no idea. I haven't gotten to that point. I would say that I don't fit in any category, so I'm going to want to keep my distance for a while.
Thank you.
Thank you, Martin. Next up, we have Hannah Chin at WHYY. Hannah, you should be able to unmute yourself.
Great, thank you. This question is for Dr. Farley. To follow up on something that Kelly was asking, I just wanted to ask, what is the current status of, I believe, the pharmacy teams that were initially planning to distribute the vaccines to nursing homes and long-term care facilities? Like, how many do we have, especially given that you mentioned that vaccine doses are going to go out to nursing homes kind of starting next week?
Yeah, I know that there are two pharmacy chains that have signed up to do this, that all the nursing homes in the city have registered with one or the other of those chains, and the pharmacies will start vaccinating those nursing homes next week. The plan is, assuming that the Moderna vaccine is approved, that they'll be using the Moderna vaccine because it's much easier to handle because it doesn't need the ultra cold storage. So I don't have more details than that, but we're definitely on track for them to start next week. They should be starting next week.
Okay, and we don't have details. When you say we don't have details on that, do you mean we don't have details on how many teams there are or how they're trained? Who are the people on the teams?
Correct. That's the responsibility of the pharmacies. You'd have to talk to them.
Okay, thank you.
Thank you, Hannah. Next up, we have John Cuff from Philly Voice. John, you should be able to unmute yourself.
Thanks. Yeah, I have one question. As you work your way through the process of administering vaccines, how will people know that a vaccine is available for them, particularly as you get beyond healthcare workers and the nursing homes to, people who are seniors or have medical conditions, they're not necessarily affiliated with an employer or a facility. So, how will they know that, it's their time?
Yeah, that's down the line, and we'll have to be doing public announcements about that of who is eligible to get the vaccine, and that'll be coupled with where they can go to get the vaccine.
John, was that the only question?
Yeah, that was it. Sorry.
Okay, no problem. Next up, we have Natasha Brown at CBS 3. Natasha, you should be able to unmute.
Hi, good afternoon to you all. This question is for Dr. Farley. Just overall, I know that you said that obviously this first round of doses of vaccines are going to go out to, essential workers, healthcare workers, nursing homes, people like that. Do you have any estimate as to when the general public this will be available to us? Ultimately, we've heard possibly sometime in the spring, March or April. Is that still a factor? Or?
Yeah, that's, I really can't give you anything close to a precise estimate because we don't know how quickly the manufacturers can produce the vaccine. I can tell you it'll be months. I can't say how many months it would be. So, April is not an unreasonable guess, but even that's just a guess. Now, I should say there's other unknowns too, and that is how many other vaccines might be approved. And the more vaccines that are approved, the more that are available, the quicker we can get to everybody.
Okay, thank you very much.
Thanks, Natasha. Next up, I have Laura McChrystal at the Inquirer. Laura, you should be able to unmute.
Hi, a question for Dr. Farley about the number of deaths that we're seeing. In the first 2 weeks of December compared to the first 2 weeks of April, Philadelphia had more deaths in April than December, and the rest of the state was the opposite. I know you did mention that you anticipate the deaths in Philly increasing, but is there any other insight into why we have been doing better than the rest of the state here so far?
Well, our case rates have been lower in Philadelphia than the rest of the state during this wave. Even though we're doing more testing, I think, than the rest of the state is doing. The other thing is that, in the spring wave, half of our deaths occurred in nursing homes. And so we were very worried about nursing homes with this wave here. We've done a lot of work in nursing homes to try to protect the people there from getting infected. And we continue to do that. And so this wave has certainly gotten into nursing homes. We've had deaths in nursing homes, but it's been much less of a problem than it was in the spring wave. I don't know if there's been that level of attention into nursing homes across the rest of the state.
Okay, and but you do still expect deaths to worsen before the end of the year. Does that seem inevitable to you, or is there something we could do to avoid that at this point?
Well, we're doing everything we can, but I do think that it is inevitable that the deaths will increase before the end of the year. The question is just how much they will increase. We're trying to reduce the number of people who get infected with things like our restrictions and our communications about how people, their safety precautions. And also, again, working with nursing homes and working with, hospitals to make sure that treatments are available, trying every step along the way to reduce that number. But, the biggest influence on the number of deaths is how many cases there are in the community. And when we've had this big increase in cases over the last few months, it's really inevitable that a wave of deaths will follow.
Okay, thanks.
Thank you, Laura. And our last question for the day will come from Brian McCrone at NBC 10. Brian, you should be able to unmute and ask your questions.
Yes, thanks a lot. Dr. Farley, New York City healthcare workers were vaccinated early Monday morning. And New Jersey healthcare workers were vaccinated starting early this morning. Why are Philly's first doses taking until Wednesday to be administered?
Yeah, I don't really think those differences of a day or two make that much difference. I can tell you that we were told all along that the vaccine would arrive on Tuesday, and all the hospitals put in place plans to start vaccinating on Wednesday. And they followed those plans. Now, over this last weekend, the federal government changed things to the last minute and delivered some vaccines earlier. So some other places did quick rejigger their schedule and start vaccinating people earlier. But again, I don't think in the big picture, a couple of days is going to make a difference in this epidemic.
Okay.
Thank you, Brian. So that is our last set of questions for the day. If you still have follow-ups, you can send those to press@phila.gov. And as mentioned earlier, there will be a 5 p.m. virtual briefing about snow preparations. That advisory was sent out around 12:30 today with all of the details. So I'm sure we'll hear from some of you then. Thank you, everyone, and have a good afternoon.